When you hear of drug abuse, what comes to your mind? Illicit drugs, hard drugs, the ordinary paracetamol you take at home, or what? Regardless of your notion of what drug abuse is, you are sure to get the right meaning here. Welcome to Regardless, an anti-drug abuse television show put together by Christ Against Drug Abuse Ministry, a faith-based non-for-profit organization under the auspices of the Redeemed Christian Church of God. My name is Louisa Olani and I'm going to be your host for the show. We'll start off today's show with a short film on drug misuse, abuse and addiction. Do stay tuned.
David!
What?
Mom wants you. You better get downstairs before she comes here to meet this pig style.
God. What is it? What is it now?
You're asking me? Okay. Maybe when you get downstairs, you find out yourself.
That's Tehila, my nosy of a sister. She really is an armful. Just in case you're in the market for a fairly used sister, I have one I'm giving out for free.
Where's your brother?
It's on his way.
On his way from where? And I hope his room is clean. Honestly, I don't understand how anyone can stay in such a filthy room. Eh?
Mama.
Hey, you. I hope you've cleaned your room. I don't want to come there and see that your room is still filthy, oh.
That's what I was doing before Tehila came to call me now.
Go to the room and ask your father to come and go to the pharmacy. Tehila needs painkillers.
But mommy, it is late now.
Yes, that is why you and your father will go out and look for an open pharmacy.
Wait, mommy, didn't we just buy painkiller like a week ago?
She said it's not working anymore. Whoa, don't interrogate me, Ojare. Go and call your father for me.
As you have guessed, that is my mother, the terror of the house, always on my case. In my next life, I will shy away from coming into a family with a teacher as a mother. All they do is lecture you.
So that's why you did not pick this. Watch this pepper.
Yes, I know the figures do not reconcile, and that was why I suggested we take another look at the year-on-year aggregate.
What?
Mom said we need some painkillers for Tehila.
At this time? Okay, I will join you.
That is my dad, who is forever working. One thing is for sure, I shall never go into finance as a profession. I honestly wonder what one can possibly enjoy from pouring out figures all day. I am sure that is why he always has a headache. Thank God he knows enough to take time off to unwind.
Yes, you do that. And I was also thinking we're approaching the end of the corporate year, and now is the time to start taking a cursory look at the tax matters.
Hey. Sorry. Where is your father?
He's on the phone, he said he's coming.
Go back. You know how quickly he forgets things when he's on the phone. You know what? Better still. Baby, come. I'm coming.
Okay, what you are asking me to do is not a normal thing. All right? Okay?
Honey, it's getting late now. Can't you just call to this phone call? Your daughter is sick.
Give me a few minutes. Oh, sorry, I was talking to my wife. Yes, as I was saying, it is imperative that we aggregate the costs with the expenses. Yes. Okay, let me talk to you later, okay? All right. Honey, I'm coming.
Here, baby. Go get water.
Mama, are this not Dad's pills? Why are you giving it to Tahila?
Look, your dad is wasting our time. Eh? Moreover, these are not very strong painkillers. They'd be able to hold her pain. Go and get the water. Sorry, baby.
Said my mama.
Sorry, baby. Sorry. Oh, you can chew? Yeah, try and chew. Chew. It will work faster.
Many thanks for staying tuned. You're still watching Regardless, an anti-drug abuse TV show put together by CADAM under the auspices of the Redeemed Christian Church of God. CADAM, of course, is at the forefront of the fight against drug abuse and illicit use in our society. That was a typical example of how families abuse drugs, and the Rufus's family will be our case study for today. I've been joined today on the show by a renowned pharmacist, one that has over 20 years of experience in the field, but has also had a first-hand experience dealing with people who misuse and abuse drugs. Ladies and gentlemen, join me to make welcome pharmacist Olaide Shoeton. You're welcome to the show.
Thank you for having me.
Now, you watched keenly what happened in that very short film. What do you think is wrong with that family?
Okay, so I would say that at first glance, you might think everything is normal, but for someone like me, I would have noticed that there is a problem here, because you see a woman who is trying to urge the father and the son and the husband to go get something to treat the daughter who has probably mismenorrhea, and you see a point where she's getting agitated because of the lateness in getting the drug, and then of course the daughter seems to be in some form of pains, and she's anxious. She's trying to get her to get that pain off. Okay, so in the process, she picks a drug that might not necessarily have been prescribed for that pain, and I think she mentioned somewhere that it belongs to the dad. So I don't think a man could have had dysmenorrhea. So why are you using another drug? To treat dysmenorrhea? So that is a typical example of drug misuse, and we see it happening every day. If someone comes to you and say, "When my friend was ill, she had similar symptoms, and this was what she used," and then you go ahead to go and use that, not knowing, not even considering the fact that drugs react, or let me use the word medicine, reacts differently in different people. So the fact that the two of you have headaches does not mean that you will get the same treatment.
At that point, right?
Okay.
You took words out of my mind. You mentioned drugs and you said medicine rather. Okay. So now because in Nigeria, maybe world over, when you talk about drug abuse, the first thing that comes to mind is maybe the hard drugs. So let's start by, bringing it down to what kind of drugs are we looking at? What really is a drug abuse? When you talk about drug abuse, what comes to mind, ideally?
Okay, so that's why I try to differentiate between medicine and drugs, because ordinarily on the streets, when you say drugs, everybody thinks, okay, drug abuse, that's what everybody's referring to. But not forgetting the fact that some of these substances, okay, are also used to treat ailments and for people to get better. So those ones are the ones that we'll call medicines, because they are for therapeutic benefits to patients. Okay, so the ones that generally drugs, which is also kind of like the street name, are the ones that are used not necessarily for their therapeutic benefits, but most times for one form of euphoria that the patient, perceived euphoria that the patient gets. So those are the ones that people tend to abuse, and some of them could actually be prescription drugs. Drugs that are prescribed for particular ailments, and then some are just drugs that are habitual drugs, things that you just use out of habit and you see yourself getting used to it, and over time you cannot seem to extricate yourself from the use of such substances.
So at what point do medicines become abused?
Okay. So anytime you use a medicine for a purpose that it is not prescribed for, that is a misuse. But when you now use it perpetually with the aim of getting some form of benefits, okay, usually because these substances actually act in a particular part of the brain, okay, so with use over time, and then you see yourself going for it every time and you feel that you cannot function without it, of course, by that time, that drug is already being abused. Not all drugs will have the same effects, and some of these medicines can equally be abused. The case in point, when we had codeine, the codeine saga in Nigeria, it was such a shameful, yes, it was such a shameful thing, because ordinarily was to treat cough, but you saw that it became a street drug. Everybody was carrying water bottles and all that, and before the thing blew in our face, and
it became something that the government had to just hold
so
a big stick. Now let's come back to the family. At that point, the woman was agitated. She just needed succor for the daughter, and the husband was a workaholic and never heeded. And the only remedy was for her to pick up that drug. And maybe if we had followed through, she had some sort of succor at that point. But like you said, that drug wasn't meant, to be used at that point. If you were the woman, what would you have done there and then? It was late at night. Of course, she couldn't go out to get drugs, and she just needed succor for that child. Do you blame her?
That's a dicey one. I would say that maybe with my background in healthcare industry, I would say that ideally every home is supposed to have something that we call first aid box. Okay, so you already know the kind of, you have a teenager in the house, that kind of thing. I'm sorry, that might not be the first time. Okay, so you should have something like that in your first aid box. If it has been prescribed for her and then she's having recurrent episodes, because this now, if she's having dysmenorrhea, that means that almost every month she's likely to have the same symptoms, and the doctor has prescribed it for her full. So for that period, she may need to make use of it. But I would say that I would blame her, because somehow, subconsciously, she's teaching her daughter to misuse drug. Tomorrow, she will not call the mom. She will go straight to the dad's table and pick up that drug. And after some time, she may even use more than the recommended dose. So that's how things like that just creep into our families. When we say drug abuse, it seems like something that is so distant, but it's happening every day in our homes. People using drugs for things that are not intended for. You have cough. You have different types of preparations that will be given for cough.
Concussions and the rest. Now you
It's
made
not a
mention.
concoction.
Yeah, you made mention of first aid box. And as a pharmacist, so typical Nigerian families, are we supposed to go through some sort of process or procedures to get a first aid box? Because if you tell me for my mom, we have one PCM somewhere, one cough syrup somewhere. And because we think these are typical things that happens for a growing child, he might pick something on the floor and decides to have a cough, and then we give him one, teaspoons based on what is written there. How do we go about having that kind of box at home? Are there laid down procedures? What are those typical things that we should also have? Because at one point you might feel, okay, these are drugs that we should have at home, and then we start taking it randomly, out of wanting to care for the child. Okay,
so I would say that to get a first aid box is so simple, because in an ideal first aid box, what you have there are things that you use to treat wound treatments. You have things for alleviating pain and similar things, and all are OTCs. Okay, so you can walk into any pharmacy and you'll be able to get a first aid box. Every home should actually have a first aid box because you have some accidents in the home and things like that. You need to quickly take something before you seek medical attention. So it's very easy to get such things.
All right, you're still watching Regardless, and we'll be speaking with pharmacist Olaide Shorter. We'll go on a short break, and when we come back, we'll delve into addiction. At what point do we get addicted to these drugs, and what are the implications? Do stay tuned.
My name is Olaide Shorter. I'm a pharmacist of over 20 years post-qualification, and I'm the MD of NHC Pharmaceuticals. First of all, we have to learn how to handle drugs. From drug misuse, it eventually graduates into drug abuse, and then we have addiction. And that addiction, that level is not where you would want to have any of your family members. So my advice to every Nigerian is that we should say no to drugs.
Many thanks for staying tuned. You're still watching Regardless. And of course, our pharmacist Olaide Shorter is still with us, and we're still looking at drug misuse, abuse, and addiction. Before that break, she spoke to us about how a typical family can have the first aid box. But how do we go about, abusing, the first aid box that we have in our homes? Again, we'll delving into addiction and the kind of socially acceptable drug, so to speak, that society abuse. We do this all the time. I might think it's harmless, but of course she's here to educate us more on that. Thank you for still being with us on the show today. Now, before that break, you're giving us a whole lot of breakdown of how there are some even drugs that are being prescribed, to families, and of course someone else in the family uses it for other means other than what it was prescribed for. Could you take us through levels of drug abuse that we have today?
Okay, so there are different categories of drugs that are abused. I would say that we have one, the socially acceptable ones, the ones that everybody seems to be using, and you don't see that there's anything wrong with it. Example, we have tobacco, we have shisha now, we have even alcohol. You go everywhere and then you can buy alcohol without, you don't, except for the children that are below 18 years, as they say. But even sometimes parents send their children to buy alcohol. So those are the ones that are socially abused. Okay, so we also come to prescription drugs. Prescription drugs can be abused. Case in point, we have things like the ones that induce sleep, like diazepam. You're on the drug, the doctor gives it to you, you say you cannot sleep, and then you're supposed to use it for like 3 days. And 1 month down the line, you're still using the drug. It has become something else because you have exhausted the time that you're supposed to use that drug. And even the doctor knows that if you use for more than 3 days, there's a likelihood that you get addicted. So abuse eventually progresses into addiction. Okay, so, and also we have the illicit ones. Those are the ones that government seems to be clamping down on. Those ones are not the ones that you can walk into any pharmacy to get, because even in the pharmacies, they are termed to be poisons, and they're supposed to be kept in poison boxes. So those ones are the ones that are the illicit ones. Some of them, most of them, you might not even find in pharmacies, except some very hospitals, like the tertiary hospitals, maybe for the ones that we have for cancer patients. But let's also come to, so those are the illicit ones, are the ones that there are laws probably against possession or use of such, and if you are found with those ones, you are likely to be arrested. And we have seen a lot of activities by NDLA in recent times.
So someone will just chuckle and like, oh, are you trying to tell me that alcohol is a kind of drug too?
Oh yes, it does. It is really, sorry, it is. Because it also acts at the same spot where most of the drugs that we use act on, in the brain. So you see, people take alcohol and then they get high, they get some form of euphoric really, and then they get boldened, something that they would not have been able to do before.
Ordinarily.
Yeah, they will do that. So it's mimicking the effect of drugs in the brain. So
Now let's talk about addiction. How do we deal with that?
So, like I mentioned before, you don't get addicted overnight. You start with abuse. And when you abuse, because these drugs are substances that change the way the body or the mind responds. So eventually, when you continue using it, there's a change. And over time, you cannot, some of those changes are irreversible. So over time, you cannot function properly without having to use such drugs. And so that is addiction. You are perpetually using that drug, and you will not be yourself again. You start having some behavior that
Until you use that.
some behavior that.
So what kind of help can people like that get? I mean, at what points can we, take them away from that before?
So, well, I would say that most times, most often than not, it's not easy to wean off such people from those drugs, especially when they have become addicted to it. So it is necessary that you seek help. And when we are talking about help, I'm talking about medical help. Because it's not... Also, if you seek medical help, you may need to use another drug to change the behavioral pattern of such people. So I would say you should seek medical help. You can start by speaking with your doctor, maybe your family doctor. Okay.
And again, we also know that, of course, in some climes, I don't know how you're not supposed to get drugs, across the counter, pharmacist, So, I mean, how do we abuse that in this country?
Well,
I mean, because yes, that's the thing.
It seems that a lot of things are lax in the system because there are some products that are supposed to be over the counter. We call them OTCs. You don't necessarily need a prescription to get such.
Okay.
Like malaria, which is endemic in the environment. You don't need a prescription to get that. Some cough syrups, you don't need a prescription. But most times when you listen to adverts, you also hear something like, if symptoms persist after 3 days, please consult your health provider. So for those things, more or less, invariably, what we are saying is that you cannot use for more than
that
a certain period
All right,
without
so
seeking medical.
What's our takeaway now? I mean, you're looking at Rufus's kind of family, the dad, the mother that has this typical situation we watched a few minutes ago. What will be your message for them?
So I will say that we must all handle drugs or medicines with care. And every home needs to be educated on the need to use medicines wisely. Everybody needs that education because most times this drug abuse starts from home. You see your mom or, some parents, they abuse the socially accepted one. A dad sending the child to go and buy alcohol or cigarettes on the way home, or maybe when the store be somewhere, after the dad has stood up, you see, I start from there. So I would say that we all need to be educated and protect our children from
such actions,
such dangers.
All right. Thank you very much, Pharmacist Olaide Soreto. You've been watching Regardless. And today we looked at drug misuse, abuse, and addiction. Before we go, I want to say a very big thank you to our program sponsors, Fitson Healthcare, NEM Insurance, CFAX Group, and also our collaborating partners, NDLEA and the National Orientation Agency. Hope you had an educating show today. I'll leave you with this, that regardless of how far you may have fallen, please remember, there is always hope. Louisa Olani is my name. See you again next week. Until then, stay away from drugs.